Good evening. You watching India Ahead with me, Neha Khanna. Our big focus at this hour. Even as many were beginning to feel that India may well have escaped the worst of the second wave of the coronavirus pandemic, let's put this question to our panel of experts. Joining us on the show, Dr. D.K. Gupta, Chairman and MD of Felix Hospital, Dr. Amrinder Singh Mali, Department of Cardiovascular Radiology at AIIMS here in the National Capital. Also joining us on the show, Pramit Pal Chaudhary, Senior Journalist. Dr. Gupta, if I could start with you. This is a question on many people's minds now. Let me in fact begin by quoting to you Kiran Mazumdar-Shaw, who tweeted earlier, "We need to vaccinate 2 million per day, and unless private hospitals start vaccinating the general population, we will struggle to keep pace with vaccine production, which far outweighs utilization. Unlike other countries, we do not have shortage of supplies." And therefore, people are struggling to understand why would the government not want to make these vaccines available in the private market for those who are willing to pay, for those who can afford to pay, at a time when we know that India is the biggest manufacturer of vaccines in the world.
Yeah, that's a great question. At the time of launch of the vaccine on 16th January, there were a rumor, there were confusion that we should get vaccinated or not vaccinated. That was a problem at that time. Now, everybody now is convinced that they should be get vaccine to prevent this spread of this coronavirus in the community. And because we need vaccine to improve our herd immunity, and we need vaccine to immunize each and everybody, we have 135 crore of population. At least 60 to 70 crore of population should be immunized. We need around 135 crore of doses to immunize 50% of the population. We know that 70% of healthcare infrastructure is dominated by private players only. 70% of doctors, 85% of the nurses, paramedical staff, even 70 to 80% of beds are occupied in India and dominated and controlled by private sector only. Anything that has to be happened in the healthcare, it should be through PPP model or through private sectors only. Like Ayushman scheme, it is run through the private players only. CGHS scheme, all government insurance scheme, they are given priority or they are given benefit to their beneficiaries to the private players only. This is a high time. We were discussing a lot during this COVID pandemic and during the launch of the vaccine also, that soon or later, within 1 month or 2 months, we will get approval for this vaccine in the private market also, because there are so many people they can pay for this vaccine, and this is not a costly vaccine also. Even we should open market for other vaccines also, like vaccine developed in the US, like
all right. Well, I take your point about how the market needs to be opened up for other vaccines also, but of course right now the entire focus, not just of India but the entire world, is on tackling the coronavirus pandemic, whose second wave, as we know, is wreaking havoc around the world, especially in Western countries. We certainly do not want to face that, and that is why is it time for the government to be more proactive and, as you mentioned, enter into that phase of public-private partnership. I want to bring in Dr. Amrinder Singh Mali at this point. Sir, as a doctor, what is your take on this entire debate? I want to present before you and our viewers a few pertinent facts here. Now, many experts have pointed out that India's vaccination drive is progressing painfully slowly. By the government's own admission, only 1 in 10 healthcare workers took the second dose on the 13th of February, the other 9 choosing to skip it for some reason. India has already supplied 23 million doses of COVID vaccines to other countries, and this does not even include the 500,000 doses that are ready to be shipped to China. I beg your pardon, Canada, later this month. And therefore, the question simply is, why should people like me, Pramit Pal Chaudhary, the viewers who are willing to pay and who can afford to pay, why should we not have access to these vaccines? Why can't we go to a private hospital and get one?
Actually, the thing is, government setup, first of all, they want to give vaccine to the frontline workers like doctors, nurses, paramedical staff, even security guards. So they want to have that particular vaccine to these set of patients, because they are fighting with the virus, because they are in more contact with the virus than anybody else. So they want to keep themselves in all the government hospitals. They are providing all the vaccine to all these frontline workers. That's why they keep the vaccine till late, so that later on the persons who are more than 50 with the disease like diabetes, hypertension, coronary artery disease, or respiratory infections, they will get benefited later on and then come to the normal public.
Okay, Prameet Pal Chaudhary, let me come to you at this point. You know, we all understand the principal argument that the government has been making for a long time, that the most vulnerable and those who need these vaccines the most should be the top priority, and therefore the vaccination drive, obviously as it should have, began with the frontline workers, the healthcare workers. But does that argument hold anymore? Why do we say this? Because according to experts in our own pharmaceutical sector, 50% of India's stocks are currently lying unused. As I said, 23 million doses have been exported to other countries, many more waiting to be shipped. You've had somebody like an Adar Poonawala saying that many of these vaccines will start expiring in the month of March. And therefore, if you have absolutely no shortage and we are worried about these vaccines expiring, then why can't these be made available to you and me? It's not as if the frontline workers are being denied these vaccines. On the contrary, the government says that 9 out of 10 healthcare workers who were administered the first dose didn't show up for the second one.
Oh, no, I agree. I mean, one of the main reasons we are being so generous with vaccines overseas is because of the slowness with which we are vaccinating our own people. Pakistan has announced today that the private sector in Pakistan will be allowed to buy and import vaccines as much as they wish. This is happening now, spreading across the world, and there is, I agree, no reason why something similar should be not done in India.
Okay.
If the government is concerned that rich people would look like rich people are getting it before poor people.
Okay.
In that case, they need to accelerate the program and start to say that healthcare workers can continue to receive the vaccine.
Yes.
But those over 50 can begin immediately.
Absolutely. And like we said, it's not as if there is any shortage anywhere. It's not as if the healthcare workers or the frontline workers are being denied these vaccines. I want to go back to Dr. Gupta at this point. Dr. Gupta, the government says, and has said repeatedly that our focus and priority is that in the first 7 to 8 months, the 30 crore people who we have identified as the most needy should get the vaccine first. That is how we've planned our strategy. That is what we want to stick to. Mr. Chaudhary says that perhaps it's now just bureaucracy that is holding us back, because as I am saying repeatedly, Adar Poonawala says many of our stocks are going to begin expiring in March. Kiran Mazumdar-Shaw is saying there is absolutely no shortage. Why is the vaccination process so slow? So clearly it is time for the government to rethink its strategy. They may have started out with a certain plan or blueprint in mind, but given the present situation and the pace of production of these vaccines, surely it's time for the government of India to go back to the drawing board and say, okay, let's accelerate things and let's definitely bring the private sector on board.
Definitely. I think government India was they were very clever to having a deal with the vaccine production houses. Like, they have not given any purchase order till the last date of the launch. They were doing negotiations on the rate pricing. They were trying to get cheapest prices, even cheapest than the WHO and the Western, like African countries also. So even they have not given a bulk order also. They are releasing a PO of very short quantity also. So that's why I think they are watching the reaction of general public, and they are also seeing the trend of the community, herd immunity in the community. Basically, if there is a herd immunity, then we need not to give mass vaccination. I think they are just watching the current trend and the reaction of the public, reaction of the spread of the infection, and they, after this assessment, they will do definitely whatever looks like to be done for the community, best for the community. But it is high time to involve private players, because it will not go from our community. It will be in our community COVID for a long time.
Absolutely.
We will have outbreaks in future. There will be outbreaks in the community. To stop these outbreaks, we have to immunize our community and
we have to inoculate our people, because look at our population. It's all very well to talk about herd immunity, but let's not forget that given the size of our population, we are more than 1.3 billion people people, it will take a very, very long time for us to get to a point where we can claim to have achieved even a semblance of herd immunity, and that comes at a very high cost because it costs precious lives. Surely we don't want to do that at a time when we are well equipped to deal with this pandemic, when we are well equipped to vaccinate our people. But I want to ask you, Dr. Gupta, why shouldn't the medical fraternity also be now putting pressure on the government? You've clearly expressed your views on national TV saying, yes, we need a public-private partnership. So shouldn't the medical fraternity, doctors like yourself, be coming forward and telling the government, you need to listen to us, we know what we're talking about, change your strategy?
Yes, definitely we are doing that through Indian Medical Association. All the doctors, nursing homes, hospitals, they are putting pressure. They are doing advocacy. Even we are not getting vaccine right now. There are so many doctors. Those who have been left in the first round, second round, they have not been picked up by this COVID app. So therefore, we all putting pressure on the government, and I think we need not doctors, they are entrepreneurs, the corporates, the pharmaceutical industry, the opposition, every bureaucrat and all buddhijeevi, whoever they are, they should ask government, they should open for the all private sector so that vaccine should be freely available in the private sector, and it should be subsidized if needed. Otherwise, it should not be subsidized also. And whoever want, they can go first basis, sir, they can get the vaccine, because there are so many persons now they are asking that vaccine is good. Now vaccine has proven after so many millions of doses has been given in India that it is safe and effective. There is no major side effect of this vaccine. Therefore, we should open now doors to all private players, doctors, clinics, polyclinics, nursing homes and hospitals. Around 70% of infrastructure that can do this job very fast, and within 3 or 4 months we can have significant population that will be inoculated if we join hand with the private sector.
Absolutely. And it is sad to hear you say, Dr. Gupta, that there are many doctors you know of, many in the medical fraternity, who for some reason haven't got these vaccines yet. And this, when we are talking about how the pace of production is absolutely staggering, and you have 5,000 doses per minute being produced of Covishield being produced by Adar Poonawalla Serum Institute of India, and many of those are going to begin expiring in March. At a time like this, why should we have a situation where so many doctors and nurses are yet to get this vaccine? And of course, I think the bottom line that we can all agree on is that it is time for government to realign its priorities, go back to the drawing board and say, we may have started out with a certain plan. It is time to revisit that plan. It is time to revise our strategy, because at the end of the day, this is a very, very, very serious issue of public health. It is a matter of life and death. And yes, all of us need to together perhaps put some pressure on the government to make sure that we step on the gas on this entire issue. I'd like to thank our entire panel for joining us on the show, and thanks very much to the viewers for watching.